Okay, Craig Stevens here, Spokane Sports and Physical Therapy, looking at knees, obviously. Michaela's here to help us out. Now, today I'm going to talk about the medial meniscus injuries. What is a medial meniscus injury if you're a patient? What happens to you? What does it mean? What can you do for it? As a clinician, I want to go over how we check for medial meniscal injuries. And this has been taught to us over the course of many years. How do we define meniscal tears, meniscal injuries? They're kind of hard to see, kind of hard to test. Now, one of the differences between the medial meniscus and the lateral meniscus injuries is typically there is ligaments involved, such as the ACL. The ACL is commonly involved with a meniscal tear, or vice versa. MCL is usually involved. The MCL helps protect the meniscus, so does the ACL. They both protect the meniscus. Now, if the meniscus has been damaged, something in the system has given way, meaning a ligament, a tendon, a muscle, something has been wrong. Now, a medial meniscal injury is normally, this is the one we see most commonly, in football, the foot's on the ground, and somebody gets hit this way, and the knee rotates, and the meniscus is torn. Meniscus is torn. Once in a while, we'll see some stuff where it's the opposite, where the knee will get compressed into a varus moment, and the body will rotate on that meniscus and cause a tearing. But normally, it's some kind of injury that involves a medial rotation of the knee or a valgus movement, and there's always stress on the ACL when we get in that position. So patients, you will typically complain of a sharp stabbing pain. You will complain of clicking, popping. You felt something give way. You felt something shift. Now, the medial meniscus is larger than the lateral meniscus. So what a lot of times people will say it will do is they'll feel a click or a pop in there. They'll feel something move or pop in there. That is typically indicative of what we call a bucket handle tear, a fairly large tear in the meniscus. So those are some of the things as a patient you will feel. You will also have trouble with straightening or bending your knee, just like with the lateral meniscus, because of fluid, because of swelling. A footnote on the medial meniscal injuries, as I said, there's a lot of secondary ligament involved. The MCL in the medial compartment, the pes anseritis region, the medial hamstrings typically are traumatized, and those will be sore, irritated, inflamed. So that will hurt usually more than the meniscus. But the signs of the meniscus are a sharp pain, in a twisting impact type of an injury, can't straighten my knee, and then I have fluid or I have puffiness in the back of my leg. I've got a ball back there. Something's not right. And as I've said previously in videos, that is the Baker's cyst. The Baker's cyst communicates with the knee, which means it's got a little channel that allows fluid to overflow into that cyst to take pressure off of the knee, but it swells up. And you see that when you have an intra-articular injury involving the knee itself. Again, the ACL and the PCL are extrasynovial. They're outside the joint. They're in the joint, but they're outside the joint itself. So you're not going to necessarily see swelling at the Baker's cyst from the ACL unless there's been a complete rupture in there. That happens very minimally. All right. Now, as a therapist, how do I test for this medial meniscal injury? Well, somewhere on the inside of this knee, there was a compression. There was a pinch. This has been pinched. So I'm going to reproduce that pinch very simply. The first place I do, usually the anterior part, the front part of the meniscus is involved more. So I'll bring them into as much extension as I can. Usually there's limitations. And very simply, my hand is here on the tibia and foot's at the ankle, other hand's at the ankle, and I very gently compress the medial compartment. Okay? That's a varus stress test. Valgus, varus. So I'm going into varus stress test. I'm compressing the medial joint. As I compress that medial joint, if there is a problem in the medial joint, as I pinch that, they're going to feel pain. Okay? Now, is that a tear? I don't know. Is that a cyst? Could be. Is that trauma to the bone? Could be. All I know is right there, when I pinch that, wow, something has been traumatized. Okay? Concurrently, if I go into a valgus stress test, okay, not considering the lateral meniscus, but if I go into a valgus stress test, I'm going to elicit irritation if there's a medial collateral ligament strain or pes ansoritis strain, or some of the medial structures have been damaged. That's pretty common too. So all I'm looking at is the medial meniscus. I'm just going to compress that. So if they've got an MCL injury, this is not really going to hurt. They're going to have pain. Wow, yeah, that really hurts, okay? Now, again, if it's more of a posterior or mid to posterior meniscal tear, I've got to bring her into flexion and then compress the joint. As I compress the joint, you'll find pain. You'll find swelling. Now, an MCL, if I take tension off of it, go into a varus stress test, there won't be any real significant pain because I'm not stressing it. So when I do the varus stress test, I know I'm pretty much testing the medial structures. I'm just kind of pinching them. Now, we can, when the ACL is torn, you can stress the ACL in a lot of different areas, and it will reproduce pain if it's a partial tear. So you have to go through your ACL testing if you're a therapist, doctor. You know that. But all I'm looking at right now is I'm just helping to define a medial meniscal injury. And I don't like the pivot shift test. I don't like banging this knee around after there's trauma. That doesn't sit well with me. So very simply, if I bring them into slight extension and compress that joint, just compress that joint, if there's a meniscal involvement, it will light them up. And it's pretty obvious when it happens. And you'll see this 2, 3, 4 weeks down the road. After about 4 weeks, that medial meniscal tear usually has kind of started to change, and it's not quite as obvious, and you have to do a little bit more specific testing. So this test, this valgus and varus stress test for the medial lateral meniscus, pinching those structures, usually is good for about the first 2 weeks, but it's really good for that initial trauma. You're out there on the field, somebody thinks they've hurt their knee, you're not sure what, don't want to kill them, you do this, no, that doesn't hurt, or oh man, that really hurts. Well, you know they've done something to the medial knee. Now, what do? Normally when I get that a meniscal injury, they're done. They're done. I don't know what it is. I know they pinched it. It could simply be bruising, trauma. But if there's bleeding in there or trauma in there, I don't want to make any kind of tear or trauma worse. Pull them out. Be safe. Don't be sorry. Pull them out. Parents will appreciate you. The coaches may not at first, but that's okay. If you're an athlete in another sport, be safe. Don't be sorry, because you tear that meniscus even more, it's surgery. A lot of times, if we stop the trauma, the meniscal tear, and especially kids under the age of 18, can heal to a degree. So you want to give them a chance to heal. If you send them out to play and there's some irritation at the knee, but they can put up with it, they're likely going to re-tear that. So, patience. You can't straighten your knee locks, it clicks. Ice is the first thing you should be doing. The second thing is, again, don't force the motion. Don't try and force this straighter and straighter and straighter, thinking I'll work through that. No, you're probably going to tear it more or break up the fluid that's on the meniscus. You're going to make things worse. Don't force it, okay? And after, I tell my patients too, after about 3 days, if you're still having a lot of pain on the inside of that knee and stiffness and can't really move your knee very well, because meniscal tears tend to get worse for the first 3 to 5 days, get in to see somebody. Okay? All right, Craig Stevens, Spokane Sports and Physical Therapy, my great assistant Michaela, thanks for watching. Hopefully this has been informational.